So again, welcome everyone to today's webinar. Next slide, please. This webinar is ACCES-VR Mental Health Webinar Series in Community of Practice. This is communication strategies when managing difficult situations and behaviors. And this webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC. We're housed at Rutgers University in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kati, and I'm the project coordinator of this center, and I will be introducing our center and our webinar facilitator. Next slide, please. So the MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. We ask that you please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. If you're interested in staying up to date with the events and products that our center is providing, we ask that you please sign up to receive our email communications. You can sign up at the bit.ly link that is on the screen and will be shared in the chat box. We also want to let you know that this webinar is being recorded and will be posted on the website along with the presentation slides within 1 week of today. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. We ask that you please not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. And at the time of this presentation, Marian Dolphin-Rittman served as Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health or Human Services or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions expressed in this presentation is intended or should be inferred. Next slide, please. So during this interactive webinar, you'll have the opportunity to unmute your mic as well as your video. You can turn that on and off. We just ask that if you're not going to use your mic, that you please mute yourself. You can also share your ideas in the chat box and just be mindful, as well as know who you are sharing it with. You can either share with everyone in the meeting or to each other. And you can control who sees these chat comments. Next slide, please. Oh, thank you, Joni. So the MHTTC uses affirming, respectful, and recovery-oriented language in all activities. And this includes language that is strength-based and hopeful, inclusive, accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, language that invites individuals to participate in their own recovery journeys, language that is person-first and free of labels, and that it is non-judgmental and avoids assumptions, and is respectful, clear, and understandable, and language that is consistent with our actions, policies, and products. Next slide. So with us today, we have Ms. Joni Dolce. Joni is an assistant professor in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers School of Health Professions. Joni has several years of experience working in behavioral healthcare settings, namely supported employment. Joni teaches courses in the department's undergraduate program, as well as provides training and technical assistance to behavioral healthcare providers. Her research interests include staff training, employment services, and she presents nationally on the topic of employment services and is listed as a Society for Human Resource Management recommended speaker on the topic of creating workplaces that support mental health. So I will turn it over to Joni and welcome again, everyone.
Welcome, everyone. It's nice to see some familiar faces. Here in New Jersey, very, very bright, so I apologize. I feel like the sun is like glowing, but it does feel nice. Welcome. Without further ado, we will get started again with a very brief survey. I'll put it in the chat. Just wanting to get some information regarding some communication skills, and just will help us to assess this technical assistance project that the MHTTC is doing currently with ACCES-VR. So I'm going to put it in the chat and ask that you kindly complete the survey. And if you were here in our first session, we probably 15 minutes to complete, maybe not that much, but as you're coming back, it's about 1:38 now. So 15 minutes from now, when you come back, if you want to pop your name and maybe an interesting fact about yourself or something that would be kind of interesting that you would want to share with your colleagues here, maybe what the weather's like in your area, what your plans are for the weekend, or whatever, just some things to kind of get some of that camaraderie while we're waiting for people to come back. So I'm going to put in the chat now, and we'll have about 15 minutes. Thank you for completing it. It's very brief. If you have questions or issues or problems with it, just pop on back, and Kati and I will help you negotiate whatever those issues might be. So we'll come back in 15 minutes, so maybe 1:43-ish, 1:44. Thank you so much. All right, I think everyone's probably back by now. Thank you for engaging in the chat, getting a discussion together. Again, we're going to be working with each other over the next few months with the learning community. So I'm trying to build in opportunities for us to get to know one another, me get to know you all, and you can get to know one another as well. So thank you. So let's get started. And this is our third of the 4 kind of training sessions before we get into the community of practice sessions. We're going to talk today about communication strategies when someone is maybe in a crisis situation, or there's a difficult situation, or someone's in a not feeling that things are going well, and what you can do. And we're going to do some applied strategies, do some breakout rooms when we get going with this. We'll have a break at around 2:30 because it is a 2-hour training. So we'll take a few minutes break just to stretch our legs. Next session on the 3rd will be applying those strategies, really kind of digging into how can we help someone, using some examples that you might bring to the table next session of individuals that you're working with to help kind of among this group strategize and just problem solve issues or concerns or challenges that you might be encountering. And then our community of practice sessions will be starting March 17th, 1-hour sessions for those. You will continue to get the CRC credits. So hopefully that's something that you all can put on your schedules, and we can continue this discussion and application. So we're going to talk about empathy in vocational rehabilitation and counseling in general, and kind of how that having empathy and that empathic the value and attitude can help when you are managing a difficult situation or a crisis when you're working with someone. We're going to talk about some core counseling skills or core listening skills primarily today, kind of along with that empathy, and then looking at some communication during crises, how to help someone, how you can communicate during a crisis. Again, none of this really takes, doesn't, this does not substitute your work with your supervisors and whatever you have in place in terms of your policies and procedures, but hopefully it'll give you some tools to use when you are encountering a situation that feels like it's uncomfortable, or feels like you could use some tools to help manage it. So a quick review, last sessions, the last 2, we focused on looking kind of internally, our values, attitudes, beliefs as counselors. We looked at a little bit of some of the signs and symptoms of mental health conditions. And I know that you've been attending some trainings with Cornell, and they really zeroed in on specific conditions like anxiety and depression. So we're going to kind of take that and really move forward with thinking about communication techniques and how to listen empathically. This may be a reminder for a lot of people who have been counseling for a while, or coming right out of your educational training. So let's, in the spirit of kind of the camaraderie and helping everyone on this call and kind of using this as a peer support opportunity, let's embrace this time to spend practicing and talking with your colleagues here. Some of it might be a repeat again, but I know personally, particularly when it comes to listening and comes to counseling techniques, I appreciate and value those opportunities to be able to practice. And even if it is a review, it's important information that can be certainly, this could be a time to practice and use those skills. So we're gonna do some breakout rooms again. We have about 30 people, so we're going to use our first breakout room. Kathy's going to configure those rooms, and we're going to think about a change that you recently made or are considering making, and you're going to answer the following. You're going to think about, was there a person who supported you in this change? How did they support you? What were some of the characteristics and qualities of that person? How did they provide support when you were making this change? And if we have the time in the breakout room, I know we'll probably have more than 3 to 4 people per room, unless Kati can create larger or more rooms and fewer people. But at least 3 to 4 people in your group, kind of think about sharing with the larger group, whatever you're comfortable sharing with. So really thinking about, what were those characteristics? What were those qualities that the person who helped you or supported you in this change, what were those and how were they helpful? When we discuss empathy in rehabilitation counseling, and empathy has been defined lots of places. I'm sure you recall in your studies and other CEU and other courses that you've attended, having that understanding of someone's experiences, right? So, and conveying that understanding in certain ways. And how do we convey empathy? How do you communicate empathy to someone? So when you think about those qualities and characteristics that you just identified when you were going through a change, what were ways that you felt like that person communicated empathy? It sounds like what you wrote: being non-judgmental, being patient, offering gentle suggestions, being there. What are other ways that, when you think about the counseling that you are currently doing or have done with individuals participating in services, how do you communicate empathy? What are some ways that you communicate to individuals? Tana Marie writes, being present. Carrie, validation of feelings. Marissa, acknowledging what they are saying. Checking in. Just listening and being there. Nonverbal communication. Am I missing? Asking, being present. Compassion, patience, and understanding. Certainly mentioned CPU. I love that acronym. Not just listening, but hearing. So we're gonna practice some of that again today and kind of reinforce the importance of establishing this empathy in your relationships with individuals, and how having this established empathy can oftentimes help when you're presented with a crisis situation, presented with a time when you may have to sort of de-escalate using your communication techniques, a situation that the person feels uncomfortable about, or the person is in or beginning to go into a state of kind of a crisis situation. So how do we, a lot of you all mentioned the qualities that the person who helped you in your change had, all relate to listening skills. You also mentioned when you are working with individuals that you use your listening skills, you just listen. But how do they know that you're listening? How do you really listen so that the person knows and understands that you are listening to what they have to say? What are some ways that you show someone that you're listening? We have something in the chat. Summarize what they're saying, Keith says. So summarize what they're saying, making eye contact, paraphrasing, so reflecting back content, what the person's saying, rephrasing, repeating it back to them, consistent eye contact, and nodding occasionally. When we talk about when you're communicating during a crisis, eye contact becomes very important, and also making sure that you're not that the eye contact is comfortable, that you're not in kind of a staring type situation. So although eye contact is certainly important, we need to also be mindful of how our eye contact comes across, even in this remote environment. Your body facing forwards, consistent, you're facing them, not saying anything or trying to talk over them, nodding, absolutely. So those are ways that we can tell someone that we're listening. Manner of presentation. So kind of the way we're sitting with the person, right? We're sitting facing them, or maybe alongside of them, however your office is situated. We want to make sure there's no kind of, and this is in a typical counseling environment, we want to make sure that we're, the desk isn't always in front of us, that there's not always that barrier. That may be necessary during a crisis situation to have some sort of barrier, but when we're thinking about a typical counseling session, we want to be sort of alongside of the person. Our tone of voice. So we want to make sure that our tone is respectful and genuine, and those attitudes that we talked about a few sessions ago. A lot of the attitudes and values in counseling that you brought up were acceptance, genuineness, and of course empathy. And we want our tone of voice to reflect that, the words that we use. So we can tell, someone can tell that we're listening by how we're using different words. We're reflecting back, like Keith mentioned, and others mentioned, we're repeating back the content that they're using and telling us, but we're also reflecting back some feeling, right? So there's a formula. I don't know if you all remember CAR-CUF and the formulas for counseling and active listening, but part of that formula is choosing the words, and particularly choosing the feeling words. So using the formula, you feel happy, excited, angry, upset, fearful, anxious, because, and then you're listening for the content of what the person is saying. Your boss demoted you. Your boss wrote you up for your lateness. So that listening involves just that manner of presentation, kind of how you present yourself, your person self, but also your environment. So kind of neat and tidy office space, the tone of voice, also those words we use, and kind of using some of those counseling techniques, those formulas, you feel, and then thinking about feeling words. I remember when I was teaching the communication techniques course here at Rutgers for the undergraduate program, a lot of times students had a difficult time figuring out what feeling words to use. So there's a feeling words list, and we can send that out and put that in the list of resources that kind of helps you kind of pull out some of those feeling words, which people have found really helpful, because you want to be accurate and accurately reflect what the person might be feeling. You also want to focus on the person. So what are those internal experiences that they're describing? Are they congruent with the external behaviors? Are they describing something terribly sad and terribly distressing while they're smiling? So you want to kind of look for that incongruence as well, and making sure you're hearing what those internal experiences might be. And this is all part of just active listening skills, making sure that we're listening in a way that shows the other person that we're empathic towards them, and that we are exhibiting that empathy and resisting distractions. I know for me, it's very easy to multitask and try to do so many things when I'm home, either, on a remote meeting or other remote. Not today. I'm not multitasking. I'm not doing anything other than this webinar, but it's sometimes very difficult to resist that. So think about ways that you can resist distractions when you're meeting with someone. How do you resist those distractions now? What are some ways when you're meeting with someone, either remotely, by the phone, even in person, how do you resist whatever distractions might be occurring in your workplace or your home office, if you're working from home, or if you're out in the community with someone. How do you resist those distractions? You can use the mic, turn off the phone, make preparation. Tana Marie mentions making sure I have the time to give them, shut the door, turn off cell phone, maybe playing some light music, quiet space. So having those, blocking out time for specific tasks, be in a quiet place without anyone around. So making sure that you're in a place that's conducive to those discussions, turning off, clean and organized work environment. So those are excellent strategies to resist those distractions, and particularly important as we still kind of navigate a hybrid or fully remote counseling. Yahara mentions try not to rush the conversation. Yes, so making sure someone else had mentioned dedicating the time that you believe is needed for that interaction. So again, just when we focus on the individual and focus on the person, we also want to be mindful of these kind of areas, the person's posture. You know, if the person is very slumped and just, you can tell that they're just, that posture exudes unhappiness or something's going on, observing all of this, making sure that we're looking and observing facial expressions and the person's grooming and what are their body movements. And these are all also important to observe when the person might be coming to you in a crisis situation. The person might be coming to you with getting fired or other losses in their lives or other things, and helping to kind of observe some of this is really important. And this idea of incongruence, again, making sure that what the person is saying is really consistent and congruent and makes sense. Robin mentions the body build.
I don't understand that one.
I think it really refers more to the posture, and I guess follows along with that posture. But you know, maybe the person has lost a considerable amount of weight as well. So kind of being mindful and paying attention, or you know, if the person suddenly has lost or gained a lot of weight, maybe that could give some indication of maybe there's an increase in anxiety or depression or other areas that might be going on. So just, I guess, paying attention to things that are sort of to do with the person's body and the build. You know, do they suddenly look very gaunt and very tired and very thin? And that could be indicative of something that's going on. And that, again, that incongruence, if it doesn't seem to make sense that the person is telling you, yes, I'm making sure I'm eating properly and I'm, you know, grooming and making sure I'm taking care of myself, and you observe otherwise, that could give you some indication that something might be going on. But thank you for bringing that up, Robin. I meant to elaborate on that. That seems like an odd one to put in, but that's really kind of,
thank you.
Yeah, body movements. I tend to kind of use a lot of body movements, which is very typical, and other people you work with may have also very typical body movements. But when you're meeting with someone and those body movements now are somewhat different or atypical, or you're seeing a lot of maybe hand gestures and typically you're not, these are some observations that are important, not just what the person is saying, but how you're observing them. So have there ever been moments when you're meeting with someone and you've observed some of these areas after not meeting with them for a while, or you could tell that someone, you know, if their facial expression is sad and unhappy and just, you know, downturned smile, but they're telling you everything is fine? Has that happened in your counseling with individuals?
Yes, very recently.
Yes, in what way? Is that
yeah, so there's a student that I've been working with at one of the high schools, And last time I saw him before I met with him recently was back in November. And he, in November, his hair was relatively short. His clothes were relative, he usually wore like white clothing, casual, but, bright colors and stuff like that. I met with him last month. And yeah, his appearance completely different. He was all dressed in black. His hair was long. He was wearing rings around his fingers. Yeah, I didn't question him or, acknowledged it, but next time I meet with him, if it continues on like that, I'll probably end up, checking to see what's going on. But yeah.
What might you say when you check in to see what's going on? And maybe others on the call have encountered something similar that could offer some suggestions in the chat. But what might you say to bring that up?
Well, I would first make sure that if I'm, just to make sure if I'm correct, correct me if I'm wrong, but, last couple of times I've met with you, your clothing seems to be different. You seem to have changed in a way in terms of your outfits and what you're wearing. I'm just checking to see, how things are going. And it's okay, you don't have to, it's up to you if you want to share this with me, but, I'm just checking to make sure that things are okay.
Yeah, I think that sounds very reasonable, particularly if you've had this relationship with the person and you've been accepting, genuine, showing empathy in previous sessions, and they have this relationship with you. Bringing up something like that they could feel really happy that you noticed, and it could be an opportunity for them to really let you know what might be going on. Yeah, that's a good observation of certainly kind of exactly what we're talking about, observing what's happening. Anyone else have similar? It sounded like Tana Marie also kind of a similar situation where observing differences in someone with their facial expressions, grooming, body movements, and so on. What was the experience, Tana Marie?
This one was along the lines of the person who just shared, but it was pretty astonishing to me because it wasn't something that happened with me. It was something that the person came in and it experienced in a different setting. And she was saying, I was trying to tell them without telling them. So that's what, all of these things were things that she was doing. And she intentionally said to me, I was trying to tell them without telling them. And so I thought, as soon as you we came across this today, I'm like, sometimes there are intentions behind it. And it was just kind of cool to hear on the other side and not actually experience it, but to have her kind of talk me through it.
Yeah, sometimes you're right. This is a way that someone can be indicating to you that something's amiss, something's not right, something's off kilter in their life or in their world at the moment. And they may not feel confident articulating that, or they may not know how to articulate it. So as counselors, picking up on those subtle and maybe not so subtle observations is really important.
I was going to say, and only because I had an experience in a high school setting in my background as an educator, I had a student who was very forthcoming. I think if you have a client who isn't as forthcoming, perhaps you may want to take a different approach. When I noticed she had a change in style, that actually happened also with a student who was transitioning a gender, and so the same thing happened. But anyway, with this young lady, I noticed your hair is different. What you do to it? Tell me about it. So instead of focusing on the whole, I only focus on one part. And she told me, oh yeah, this is what I'm doing. I'm trying this new thing, and blah, blah. And so it went on to, to her disclosing what was happening. So if instead of focusing on the whole, maybe break it down that way. In this
Mhm.
case, with this person, maybe a ring or something. For Keith was mentioning his student.
Yes.
Maybe just focus on a ring and say, hey, tell me about this ring. What does it have a meaning, or what's up with that? Whatever.
Yes, and it shows the student, shows the person that you're observing, that you're attentive, that you're paying attention, that you are attempting to understand what's going on from their perspective. You're showing that in the way that, just like you had mentioned, Yahira, the way that you kind of just very genuinely and respectfully ask the student about their hair, and how Keith is going to or may ask very respectfully the student he's working with about what's going on with them, but you're showing the person that you're interested and you're attempting to understand. We have chat. Sometimes those changes, I don't know how to pronounce your first name. Would you mind the most recent chat, if you could just unmute so I can, it's CQRL.
It's supposed to be CA. I don't know why. I had to update.
All right, thank you.
I had to
All right,
update the
Carlene.
Google. I had to update Zoom right before the meeting, and I don't know why it changed my name, but it's Carlene.
Okay, I thought so, but didn't want to, I wanted to make sure. All right, so Carlene, let me see, you wrote, sometimes those changes are what an individual wanted to have arrived to for some time, so may have been afraid to approach or dispel the myth that change is bad, can be and can be supportive. So genuinely acknowledge the absolutely genuinely acknowledging that observation. Yahira agreed. That's why focusing on a small part allows for a conversation, but yes, change can be powerful. And most of the people that you're working with are more than likely involved with some sort of change process, whether it's going back to school, going back to work, changing careers. But that change is part of that person's life, and you're counseling with them. What are some barriers to listening? And then after this exercise, we're going to move on to our second part of the discussion, but I do want to kind of close this out with some barriers to listening so that we can be mindful of what those might be. Outside distractions, getting too much information at once. So yes, Wendy, I agree. Masks. Carlene, that's a wonderful observation now, because I think you're right. 2 years ago, we would never have been saying that masks were now a distraction or a barrier. How have you resolved some of that? What are some of the ways that you and others here on the call have gotten past that or resolved that barrier of masks? Smartwatches are, yes, smartwatches are a distraction. Marissa's writing remote meetings due to tech difficulties, sound cutting on and off. Yes, it feels like for the last 2 years, whenever I hop on a Zoom call, I'm not surprised that some sort of tech or glitch happens. Listeners preoccupied, live transcribed for those who can only read lips. Yes, so those are different barriers. The person, Kathy mentioned listener being preoccupied. What are some ways to overcome that barrier, help the person be less preoccupied when you're meeting with them? Tana Marie, setting an agenda helps. Timing that works for all. So making sure, just like we had mentioned for ourselves and be prepared, making sure that the allotted amount of time works for that person's schedule, that it's not cutting into other tasks and responsibilities. Carlene writes, simply ask for their undivided attention for a brief period of time. Asking, we have 15 minutes together, we have 20 minutes together. Can we both commit to focusing on this task at this point? Refocusing on something right in the moment, helping to kind of refocus and redirect the conversation back to what that is. Absolutely. So I just put this as an example of solar. If you're a recent grad or even attended some recent webinars, again, it's just a nice, clean acronym, I think, to help us remain focused and help us sort of, it's the squaring, open posture, leaning in, eye contact, and relaxing. It's a way to sort of show the other person that you're listening when we are squared off. So we're sort of sitting kind of alongside, making sure that we're not directly, right in front of the person, or kind of squared a little bit, and our body language is very squared. We're open, so our palms are open. If you want to get very exaggerated with it, or you're just open, no legs crossed, no arms crossed, leaning in a way, eye contact, and then relaxing. And again, we're going to talk about when there's a more crisis situation, how we want to listen. But in a typical counseling session, when we're trying to convey empathy and creating a relationship, developing a relationship with someone, we want to use this solar. So Marissa writes, checking in with them every so often, not just continuously talking, giving them a chance to process information. Yes, orienting someone to the session. In the psych rehab field, I'm sure in other fields, orienting is something that's highly discussed. So telling the person kind of the what, where, why, and how that session is going to go about, and asking for that person to not so much repeat back to you, but asking, I want to make sure I conveyed what we needed to convey. Would you please kind of let me know what we're planning to do today in our session? And you can catch in that moment if you're both sort of anticipating different outcomes for that meeting. The person can tell you, kind of repeat back and reflect what you said, or the person might not have any understanding or might not have been listening. Then you have a chance to repeat that. But before we move into our next topic with the crisis, I just want to also remind us that we want to avoid lots of questions. It could be threatening, defensive to people, leading. People might not feel able to answer some of the questions that you have. So using more of that reflective responding, summarizing, like people have mentioned in the chat, open-ended questions. If you are going to use questions, try not to use a series of closed-ended ones, but reflecting back that content and feeling is preferred to not lead to some feelings of defensiveness, feeling threatened by the questioning. So why don't we take maybe a few 7-minute break? So it's 2:33, or it doesn't even have to be that long. Five observations that you might have had when communicating with someone in a crisis. And let's first define kind of what a crisis is. A crisis is really when someone might be feeling overwhelmed. They might be having a difficult time coping with a situation. It might escalate to the point where the person might be angry or fearful or sad or overwhelmed. Could be due to a variety of factors. Maybe there's been a death in the person's family, job loss, conflict with in a relationship, other areas in someone's life that could potentially be causing this feeling of being overwhelmed and difficulty concentrating. People might feel that they have an inability to deal with whatever a situation might be that's causing them distress. But getting back to thinking about communicating during a crisis, have people had to communicate during a crisis situation? What did it feel like? What was it? What were your feelings around that crisis and the communication? Tana Marie, provide a safe channel for feedback. Absolutely. What were some of your thoughts and experiences in a situation where you may have needed to de-escalate a situation that was either a crisis or close to becoming a crisis? So think about that as we kind of transition to looking at some of maybe the common causes of crises. And again, this doesn't, not an exhaustive list, and certainly not everyone who experiences symptoms is in a crisis, but psychiatric symptoms, substance use, a combination of both of those could cause crisis situations. The person may feel frustrated about something, they may be angry about something, they may not have the maturity to manage situations that arise, whether that's kind of a vocational immaturity, maybe the person hasn't worked or hasn't worked for a number of years and may not know how to manage or deal with certain situations on the job. Could be a medical, something physically going on with the person, or could be a level of fear. And then external, that loss of someone important to them, maybe the loss of a job, maybe the loss of a relationship, death, being a victim of something, and trauma certainly can be a cause of crises. Let's see in the chat. Marissa writes, alert appropriate staff, absolutely. So your supervisor, security. Kathy, I try to mirror calmness. Yes, so, and when presented with that, those are all good techniques and ways to help manage that. But are there other common causes that you can think of that might be causes for crises or someone's fear or whatever they might be experiencing? Betrayal. So someone might kind of externally might have been betrayed by someone, a boss, a spouse, a friend, whatever that might be, family member. There might be unknown anticipated losses, death, eviction. Yes, so externally someone might be experiencing the death or eviction, or that anticipatory grief. Someone might know people or might know someone who is ill. There might be a sudden onset of illness for someone, any unwelcomed change, job loss. Yes, so there are certainly lots of causes for crisis in someone's life. Injury, yes, so someone may not be able to work in the same job, may have been injured, may be feeling physically unwell and in pain. So some of what we want to make sure, I think Marissa might have written it earlier, or Tana Marie wrote this down. We really want to make sure that we alert appropriate staff, understand what your procedures are. These are just some example procedures that probably more than likely most organizations follow. What are your policies and procedures for managing crises? Maybe that's something to really look into and make sure you're familiar with before a situation occurs. How and who do you call for help? Is there a phone in your office? Is there an internal number? Is it just the 911 or emergency, or whoever that might be? There might be policies and procedures in place that you want to make sure you follow. And what do you do if it's off-site? So I don't know, you may be working off-site in various capacities, potentially with individuals. What do you do when it's off-site? So just consider and think about these procedures and how and what they might be. When we want to kind of de-escalate a crisis situation, we want to use those communication skills that we talked about. We want to make sure, just like was Kathy mentioned, we're calm, we have an even tone of voice, we're listening non-judgmentally to someone, right? We're exhibiting those attitudes of acceptance and genuineness and empathy. We want to be attentive, and we want to make sure that we're maintaining a comfortable level of eye contact, that it's not jarring or piercing, but in a comfortable way. we want to, again, have an openness to us. This could be kind of, this could accelerate a crisis. This could be perceived as defensive, and this may not be the appropriate way to manage when someone is in a situation where they may not be calm. Just like Kathy mentioned, your calmness needs to kind of exude so that they can feel that control is within someone's hands. That non-judgmental, when we think about what we don't want to suggest to the person what they're feeling isn't justified. We certainly never want to refer to whatever the crisis is as not important, or oh, you could just kind of, just snap out of it, or there's lots of ways that this could be fixed. Really want to make sure that we're not creating a worse situation. We want to make sure that we're calm, that we're speaking in a very slow manner, that we're not kind of mirroring quick speech and other body language and tone of voice and eye contact that isn't helpful. We want to remain calm. We don't want to be kind of jarring in our movements, or making sure that we're not, making sudden movements or anything that could be perceived as disrespectful or unhelpful, or even provoking whatever the crisis is that someone is currently involved with. We want to help someone be able to vent what they're feeling. So we want to make sure that someone is able to tell us what they are feeling. And we want to use those listening skills, the nodding, the eye contact, the solar. We want to make sure that we're hearing what they're telling us. This idea of creating choices. We can, help them feel safe. Yes, Wendy, we want to help someone feel safe. We want to create choices. We don't want to just tell the person what we're going to do. Well, I'm going to call your doctor. I'm going to get in touch with my supervisor, helping the person see that they're part of this. And depending on how escalated it might be, you can say, tell me what you would like me to do in this situation. Would you want me to call one of your supports with your permission? Would you want me to get my supervisor? Create some choices for the person, whatever that might be in that situation, to help the person feel as if they are part of resolving this crisis. And certainly you want to focus on the present. You want to focus on right now, what's happening, and helping the person resolve what the current situation is, and summarizing back to the person, letting them know that you're hearing what they're saying, that you are understanding, and that you're being empathic. Certainly you don't want to say anything to make the person feel angry or upset, but you also want to make sure that the person is safe and that you feel safe. So some questions that you might want to ask if you are seeing someone in that kind of experiencing the stress. You can say something like, from the way you're seated, you look depressed, you look unhappy, you look whatever way the person, tell me what you're experiencing. I know you're upset about losing your job. I know you're upset about your performance evaluation, which wasn't a great one. Or I know you're upset about whatever that might be, tell me more, asking the person to give you some more information, tell me what is making you upset. You want them to really, you want to convey to them that you are there, you want to hear them, you want them to describe what they're experiencing, seeing, or hearing. If someone's responding to hallucinations, which we've talked about in the past, you want to make sure you're giving them an opportunity to tell you what they're seeing or hearing or experiencing, and not dismissing that. And that'll give you some indication of what might be going on. Looking at usual versus unusual behavior. So if someone is typically kind of comes in and dressed in a very eclectic way, and that's not very unusual, then maybe that's nothing. But if someone comes in, like Keith had mentioned earlier, dressed very differently, or different hair, like Yahira said, maybe kind of recognizing that there might be something going on, evaluating what those behaviors might be. Is there a relapse, not just co-occurring disorders type relapse or substance use relapse, but is there a relapse? Is the person experiencing some of those prodromal symptoms of the mental illness? Is there something going on that might be indicative that the person isn't doing well? And then determine what that safety risk is. And again, referring back to your supervisor and your policies and procedures to determine what to do in that situation. So again, if someone is actively agitated, you certainly want to make sure that you know where the exits are, that you're maintaining a distance from the person, that there are some barriers in the way that if the person is visibly agitated in that moment, you want to make sure that you are adhering to some of these kind of strategies and certainly whatever your policies are in your organization. What are some of the policies in your organizations when someone is agitated or in a crisis situation? What are some of the things that you're all expected to do or have done? Okay. Always remaining calm. Yeah. Thank you, Carrie. Any other? We have a couple more here in the chat. I remove myself, Robin. Yep. Suggest rescheduling. Yes. If the person's not in an immediate dangerous situation, rescheduling when the person is in a feeling differently and feeling better, escorted to a waiting room. Yes. So following whatever policies, procedures your organization has, a backup support from a supervisor. Yes, Carrie, knowing what that is. Who is your backup support person? Is it your direct supervisor? What if the supervisor is not there? Who do you go to? Kathy mentioned, let someone know, keep the door open when meeting, put yourself between the person and the door. Yep, so making sure that you're closest to the exit, you have a line to the exit. And again, this is when someone is agitated or experiencing something that's creating discomfort for you. So we're going to talk a little bit about some of these scenarios, but before we get into some of the ones that I have already crafted, I did want to get from you maybe a more elaborate example of individuals that you've worked with who may have been in a crisis or may have been agitated and how you responded. But why don't we do James first? We'll walk through his scenario and then we can get a sense, you can get a sense for kind of what we're doing here, and then would love to be able to go through some of the examples of individuals that you're working with. So James meets with you for the first time in your office. He seems distracted and unable to focus. You're trying to gather the necessary information to assist him in getting registered for services. He's actively experiencing symptoms. He's responding to auditory hallucinations. He has an inability to concentrate, and he's moving from one topic to the next. So we can open up the chat, and also certainly if anything wasn't clear and you want some clarification on certain areas. Here is a list of resources, and I added the suicide prevention hotline because although we're not going to be talking about that specifically in this series, one of my colleagues, Ken Kinter, is coming in the end of March, maybe March 21st. I don't know the exact date or if that's been publicized yet, but I think March 21st, he's going to be presenting an hour and a half webinar on suicide prevention and suicide assessment. So that will be forthcoming, but here are some other resources. I just kind of threw on a lot of the mental health related ones, and reference evaluation. I think Conti will be putting in the chat the link to the evaluation, and you could use the QR code here. If you want to you can pop your phone right up to the QR code.
Thank you, Joni. So in the chat box, I included the link to to our short evaluation survey. As always, feel free to reach out to me if you have any questions, but I just, as a friendly reminder, it does take up to 7 days from today's training for the slides and the recording to be posted on our website. So I just wanted to just provide a gentle reminder about that. So I do send out an email announcement once it is posted with the link as well. Certificates of attendance are generated by our intranet, and it's sent to the email that you joined us today. So sometimes if you have joined from a phone or something, unless you have any other kind of identifying information, it might be a little bit hard to locate your certificate, but email me anyway, and I will forward your request to the person who handles that. Any questions regarding CRC credits, please contact ACCES-VR. They handle any information or requests or questions about CRC credits. So I just wanted to let everyone know. Okay. Thank you, Joni. I'll turn it back to you. We hope you continue to stay safe and well, and we look forward to seeing you on the 3rd for our next session. Be well.
Thank you. Have a good night.
Thank you,
Bye.
everyone. Conti, did you see Isaac, my cat, at the door? Making an appearance.